Well, thanks. This is a fantastic event, and I want to thank everybody in France for their engagement in this important cause, and particularly President Macron. Every time I listen to him, my energy and idealism is renewed. So he has been a perfect host and done a great job, even to this minute, making sure we get as much as we can for the Global Fund. Everybody here has really stepped up, a lot of generosity, and although we don't know the exact total yet, there's no doubt that we've made a significant increase in the funds for the Global Fund, by far more than we were able to do 3 years ago. It's particularly amazing when you look at politically, there's countries that are talking about turning inwards and really questioning multilateralism. But here, we see that to solve the toughest problems, whether it's disease or climate change or terrorism, people really have to work together. The private sector, I'm very proud of the engagement there. It was early this year in Davos when Peter Sands announced what I thought was a very ambitious goal, $1 billion. That's a 30% increase from what came out of the private sector 3 years ago. So just 8 months later, I'm able to say that that was achieved. And our foundation is proud to be a part of that with our $700 million commitment. So the dollar amounts, the resources are very, very important. But I want to spend a little bit of time helping you understand what that maps into, what the impact on human lives really is. The best way is to start by talking to you about bed nets. Bed nets actually go back to the ancient past. The ancient Greek historian Herodotus wrote about how Egyptians living on the bank of the Nile would fish with their nets during the day and then sleep under them at night to keep away malaria-transmitting mosquitoes. That was back in the 5th century BC, and for thousands of years, that's how malaria prevention was done. Just a physical barrier between the humans and the insects. It's only been within the last generation or so that the new approach was developed, and that's to coat the nets with insecticide. And this makes a dramatic difference. And not only was this done for thousands of nets, it was literally done for millions of nets, and they were distributed by the Global Fund free in the endemic countries. The Global Fund got started in 2002, but by 2007, just 5 years later, it had distributed over 50 million nets. And then look at what happened. As those nets get out there, the malaria deaths that had been growing globally start to decline, and decline by a substantial amount. At this point, the fund has sent out 1.3 billion bed nets, 131 million just last year. And so this is something very important to understand about the Global Fund. It moves quickly. It's very analytical. It's working with the top disease experts in the countries on really aggressive plans. It is the fastest scaling, most effective health institution that's been created. If you look into the country level, you'll get an even stronger sense of this. For example, take a young girl in Zambia. She's half as likely to die of malaria than her mother was at that same age. Thanks. It's tricky. Consider India. In 2000, a girl growing up in Manipur had a 1 in 1,500 chance of getting malaria. But today the odds are 1 in 30,000. And it's not just malaria. We can see the same thing with HIV. What we're showing in this graph here is different countries in Africa and Asia starting in the year 2000. The further right the dot for that country is, the higher the odds that someone in that country will die of AIDS-related causes. We can focus in specifically on South Africa for a moment. If you were living in South Africa in the year 2000, you had a 1 in 300 chance of dying of AIDS just that year. The odds increased over the next few years. By 2004, they'd increased by 50%. By 2008, they doubled. But then look at what happened around 2008, just 6 years after the Global Fund was launched. The odds started to drop and then plummet. As the Global Fund scaled up, you can literally see the tide turn in the fight against HIV. And these dots, these risks of dying, will continue to go down. That is, move further to the left, because the Global Fund is constantly getting better at what it does. It's constantly learning. Let's go back to malaria. The year the Global Fund launched, we had never sequenced a mosquito. We didn't understand the mechanisms of resistance. We didn't really even have good numbers on where or how many people were dying. But today, we're sequencing thousands of those mosquitoes' genes every year. And that lets us pinpoint how the mosquitoes are changing and how the disease is spreading. And we know the malaria deaths in many countries all the way down to the individual village level. This is the map of Zambia. So instead of coloring the whole country one color based on the overall malaria deaths, we go down to a 1 kilometer by 1 kilometer box and measure malaria deaths at that level. And what you can see is there's a dramatic difference. In the south of the country, the malaria intensity is quite low, and then as you move up to the north, it's very, very intense. And that helps us target the disease the right way. It helps us send the nets to the right places because those have also become far more advanced. When we got started, the insecticide-treated net had just one ingredient, which was an insecticide called pyrethroid. Over the years, though, we've seen that mosquitoes are starting to become resistant to that chemical. And we saw, actually, in those sequences that this resistance had evolved in several different places in Africa, which shows that we were doing a good job getting those nets out so that only mosquitoes that had this Kelch mutation were able to survive. Fortunately, in the R&D pipeline, we were working on a new generation of nets. And we have now today the Interceptor G2. This is the Interceptor G2 right here. And these are new, but even in the next year, they'll be going out by the millions. Our foundation has been working with BASF and MedAccess and the Global Fund to get 35 million manufactured over the next 3 years. And by committing to that volume, we've been able to bring the price down so it's not a substantial premium over those previous nets. A key point here that this makes is that the Global Fund is the world's connection between the research labs and the people who need the innovations. Without the Global Fund, this incentive to make these new tools would not be there because there wouldn't be a way to get them out and get them out quickly. And that dialogue between the researchers and the Global Fund about what new products will make a difference is very, very important. When there's a breakthrough in science, the fund makes sure that that breakthrough helps as many people as fast as possible. Over the past 3 years, for example, the fund changed the first-line regimen for HIV. The new regimen is far less likely to develop drug resistance. That's actually one of the biggest challenges with HIV drugs, is if you're not taking them every day very carefully, you develop resistance. And not only is that bad for you, but there's a chance that you'll transmit it on to other people. In 2017, a new drug called dolutegravir was recommended to go into that three-drug combination. And there's really good data about how hard it is for the virus to become resistant to that new drug. Now, thanks to the Global Fund, there's enough dolutegravir supply for more than 7 million people, and the fund is getting it out there very rapidly. The last time we needed to change the first-line regimen, it took 3 years, and this time we'll get it out in 18 months. And that's just one example. Over the next 3 to 5 years, the innovations flowing out of the pipeline will be even more impressive. It includes not just that bed net I showed you, but other new bed nets as well. It includes new TB drugs. Many strains of tuberculosis have grown resistant to the current first-line regimen, but there's a new triple drug regimen that is working even against the most resistant forms of the disease, which is also often called XDR, or extreme drug resistance. They used to use a regime for XDR that took a year and a half and had terrible side effects. But we've seen the effectiveness of this new regime, very few side effects, very good success rate, and working within 6 months. There's also a new TB vaccine in early clinical trials. If it works, it'll be the first TB vaccine in over 100 years. It will supersede the current one, which is actually only modestly effective and is only helpful to infants. Perhaps even more exciting, though, are the breakthroughs that are coming for both treating and preventing HIV. We've always had a dream of having a drug you could take that would protect you from getting HIV. It's called prophylaxis. Right now we have that drug, tenofovir, but you have to take it every day in order to be protected. And that daily schedule has been extremely difficult. Young women in sub-Saharan Africa don't want to have drugs like that around and have people looking at them and developing stigma against them. When we looked recently at 427 women living in South Africa and Zimbabwe, under 10% were able to have the drug, active drug, on a constant basis. Interviewing those people, though, we found that if we had a monthly pill, that we could get very high compliance. And in fact, a pill like that is in the pipeline. They'll be able to either take it at home or go and get it at the local clinic. We expect by the time of the next replenishment, 3 years from now, we will have that tool, and it will be phenomenal in reducing the number of people who get HIV. There's an even better form of it that will come a few years later, and that's the idea of a single rod that you can put under the skin like reproductive health implants, and that would last for an entire year. And so the compliance will be particularly easy once we get that into that form. Planning ahead for those innovations, making sure it fits the profile of what the Global Fund has seen in the field, that's partly why we can be so optimistic about reducing the number of deaths. In fact, the good stories about the progress we're making don't often get told. Often you just see the tough news about the deaths that remain. In fact, it was when my wife, Melinda, and I saw an article about diarrhea deaths, it really shaped the priorities of our philanthropy. It was stunning to us that hundreds of thousands of kids were dying from diarrhea. When it came to HIV, there were a lot of dire predictions. A U.S. magazine talked about 10 million orphans and said that AIDS was cutting through the population like a malevolent scythe. Later that year, a European publication talked about Africa had a time bomb on the doorstep and that it could lead to the collapse of nations. Of course, because of steps that were taken, including, most importantly, the creation of the Global Fund, those dire predictions did not come true. The world started getting healthier, not sicker. But in some ways, people's perceptions have not caught up to that reality. Before he passed away 2 years ago, my friend Hans Rosing used to go out and ask even sophisticated people what they knew about what was going on with global health. And he found that people consistently thought that it was worse than it really is. It's understandable because the news that gets through most directly often is the setback. Good news is that a slight improvement every day is harder to build into a headline. But we do need to talk about the exemplars. We do need to talk about the progress because we are going to have to sustain this fight. This is not the last time we'll have a replenishment event. In fact, it's not the only organization that works in health that needs resources. In the same way that Global Fund marshals resources to fight AIDS, TB, and malaria, Gavi does the same thing to vaccinate children. And the Global Polio Eradication Initiative does it to eradicate polio. And both of those will, over the next 12 months, have replenishment needs. We definitely want, as we save lives, to reduce all of these diseases that mean a child in a poor country is 50 times more likely to die than a child in a rich country. So here's one further commitment that I'll make. We've been talking, a lot of the people here in the audience with me, about raising this money today. That's gone very well. Even during these 3 years, I have a commitment to keep raising money. In fact, between the work that Bono, Peter Sands, and I will do, we're committed that we'll raise at least another $200 million during the 3-year period. You might ask, is that really doable? Well, in fact, in the last 3-year period, we were able to raise an additional $300 million above the pledge amount. So I think we're being very realistic. There's lots of governments where the exact timing to make multi-year commitments doesn't work for them. Lots of new people who want to come on board as they see the great work being done here. We do want to get the good news about this work out. Of course, you can have a headline, but you won't see it very often. The headline could say, compared to 30 years ago, half the number of children are dying every year, even though the world population is up by 40%. Or you could have a headline that the last time the global number of AIDS deaths, the first time the global AIDS death fell was 2 years after the founding of the Global Fund, and it's fallen significantly every year since. Or another headline could be, Global Fund saves 14,600 lives today, and you could run that literally every day, and it would be new, and it would be true. So these are remarkable stories. We all have to work to make sure the truth about this work gets out, because that's what will justify and encourage more of this incredible generosity. Thank you.